Es el blues eso que a ver cómo se ve. Vale, sacando un blues para... Hola, hola.
Quería estar, pero no. Fíjate quién soy.
Si me da tiempo.
Prueba.
Esto es una basura.
¿Tienes batería también?
Esto está al 100%. No lo sabe. Está encendiendo aún. Que me va a quedar sin batería si no es olvidarse la cámara. Por eso te he dejado esta batería. Porque si se muere la puedes cambiar. Si se me muere, mira, pues en mi caso es apagar la cámara, apagarla,
Sí.
¿vale? Y aquí debajo, palanquita,
Clic y meter
y tienes una de esto que sacas la batería, una cosa azul,
Sí.
pum, metes la otra, cierras la pestaña
Vale.
y encender.
Y encender. Apagar y encender es aquí.
Encender y apagar, sí, ya está. Y no tocar nada y ya se saldrá igualmente. ¿Cuál te has conectado? De esto.
¿No te pensabas que te ibas a quedar tú con la loca?
Com estàs? Com està el teu peque?
Molt bé.
Està guapo? A veure? L'altre dia hi pensava,
No, pero no soy este, ¿eh?
que fa un any. Fa un any que estàvem a Roma i imaginava, dic, deu estar enorme.
Máster.
Sí, estoy haciendo el máster con este.
Con este. Es verdad. Vamos a hablar de los cines.
Testing? Yes.
No puedo aguantar.
Well, I think we can start by now. Welcome everyone to this satellite event of ELS 2.0 European Conference. We are here to talk about ELS 2.0 instruments and solutions that could help nurses doing the mission and reach their goals and objectives and outcomes with patients. So we will have a very interactive session with a presentation of 6 demonstrations. And to help us to do some critical position about the solutions that we will assist, we have Chris Farmer and Tracy Clevenger. And I'm going to present both Chris and Tracy and then to present myself. Chris Farmer is an associate medical director at East Kent Hospitals. So he's renal nephrologist and also a professor at the University of Kent. And spends the most part of his time working with this kind of solutions. And I think he became acutely aware of the need for more comprehensive and effective doctor tools to treat these patients that you are airing. So this led him to develop a more advanced renal medicine clinical decision support system. So we'll be addressing why these tools are necessary and how he successfully managed to implement a new model of care. We will have Tracy. Tracy is a nurse manager at the Burn Center in Uppsala University Hospital in Sweden. And Tracy not only will do a critical position on our demos, but also she will present the demo. Okay, so I think we will start. I'm presenting myself. My name is Tiago Vieira Pinto. I'm Portuguese, and I'm a family nurse. In Portugal, I work in a family health unit in Porto, and I work also at the National Association of Family Health Units. I'm an advisory board member of the European Forum for Primary Care, and that's why I'm here, representing European Forum for Primary Care. So I think we could start. Tracy, if you don't mind, go ahead.
Okay. I'm proud to and happy to present to you a working environment called Daily Management at Uppsala University Hospital Burn Center in Sweden. What does daily management means to our Uppsala Burn Center? We have created a time and place for the Burn Center team to meet and communicate. How the team gets to meet for 10 minutes in the morning and 5 minutes in the afternoon to discuss and go through the patient activities together. Why? This is to put aside their individual professional priorities and centralize the care of the patient from the patient point of view. This is also an opportunity for the team to foresee potential problem and weakness in planned activities and adjust it to benefit the patient and to create a good working environment. These are the members of the Burn Center team. As you can see, there are lots of them, different professionals. For us who work in healthcare, we realize that this is quite really an accomplishment to gather a team of doctors, nurses, paramedics in one location and time, let alone twice daily. And for those of us who work in hospital know that bed shortage is a common problem. We too in Uppsala Burn Center have to sometimes relocate our burn patient to other wards. So how do we ensure that the relocated patient receive the same specialized burn care as those in our ward? We make sure that the staff from the other ward get to communicate with the team, and in this case through telecommunication. Even though this system of virtual conference is established in my hospital, implementing it wasn't easy. Lastly, but most importantly, when the daily management is established, we realize that the nurses that are closest to the patient are also the last one to know about the planning, since they can't leave the patient to attend the meeting. This problem is solved by simply using an application in the computer, and they are connected to the meeting and now can listen in. So, as you can see, we have 3 types of equipment: the whiteboard, the virtual conference room, and the computer. And one of them is not digitalized, which is why in the near future we are converting our whiteboard to a digital in a Microsoft Surface Hub. For those of you who doesn't know what a Surface Hub is, it's an interactive whiteboard with conference screen and touch screen technique. I would have loved to demonstrate it live to you all, but unfortunately it got damaged during transportation, so you have to see it from my computer screen. And before I start my demonstration, I would like to share with you my experience in implementation of new digital technology to my team of nurses. It is very important to have recognition factors. This is done through intensive advertisement and promotion of the product to my staff as soon as I hear that it will be implemented in the future. Since I am an enthusiastic leader, this is not a problem. I like to keep the information to my staff simple, and it is very important with troubleshooting. You must find out if it is the product or the user and clear up the misunderstanding before the negative starts spreading. I believe the product is always user-friendly. And of course, the support from the upper management and IT service is really a priority. Now, I will demonstrate it is a Surface Hub application. And it's quite straightforward. I'm sorry that you have this minute screen, but we'll need to. As you can see, I have all my patient on the left. Very easy, simple. Let's go it up. I just have a room. I have a name. Because this is not a patient journal, I have to go under the radar, but I still need to be able to connect to the patient journal. Now, I'm very interested in know how many % of the burn surface area it is, and when is the emission date, and the computer will generate. If it's a red, it means it's 2 days overdue. We count that 1% per day. The patient should be staying. So within the discussion and meeting, you ask, have you all thought, why is this patient delayed in discharging? But if it's minus 40, plenty of time to do. So what do we do? All those that is already done have this beautiful and today is Wednesday. I will put a wound care, and as a staff, I can assign. I think I can assign. Yes. I can assign my staff this. And this is a picture. It's better than name. Because of the consultation, okay, that's it. Sorry, my time is up. But if you're interested, yeah. I'm sorry, it's fine. It is very easy. I would love to just show you this. This is beautiful. This is a legend. I will put the wound care. I will put the sedation. And if during the day, it may be even an X-ray. Imagine it's cancelled. I could just drag and drop. As I thought. So, and it stays on because then this is to be able to backtrack. Imagine I have 1,500 pictures on my iPhone at the moment of the physical wall because I would like to look back if there's an infection, which is the case. Okay, my time is up. I'm sorry. I would like to show you more.
Don't mind with that because we will have a scheme. We'll have 4 minutes to each demonstration. It's not much time. We all know that. But in the final of the session, we will have about 15 to 20 minutes to discuss and to, well, even to say something that you didn't say on the post. Okay, and 1 minute to change the theme of the presentation. And in this 1 minute, we can do 1 or 2 questions, a very objective one. I will give freedom to Tracy and Chris to question whatever you want. I know. And we don't have questions, we can go ahead to the next demonstration.
While they're doing, I will steal some more time. What I'm trying to promote is actually this working environment. I mean, I'm sure that you all have all this gathering. And to be able to get all these professionals in one place and talk for the greater good of the patient and not because of the professionals. It is actually very nice to see everything happening in my home. Because the patient will get the optimal care and the staff will not be out stressed because of the bad planning.
You ready? Okay, thank you very much. Bartley O'Connor from Patient Pharma. Just to say that Bartley O'Connor is the founder and CEO of Patient Pharma, and the Patient Pharma platform helps nurses and doctors to support and engage more closely with patients.
Thank you very much.
Okay,
Great.
please go ahead.
Our platform essentially has two parts. One is the two-way engagement part, which we're going to demonstrate now. My colleague Colin is going to play the part of a patient, I'm going to play the part of a nurse, and then we're going to look at what happens in the video when it actually gets into our system, how it can be analysed as well in terms of pulling out, extracting insights which can be used more broadly across the population. Colin's going to record a video using our app. First of all, we're going to see it coming in on my app. Colin is the patient at home. He is on a clinical trial. He's 50 miles from his medical team, and he's got an issue, so he doesn't know what to do. So he's going to record a video. So he's now starting to upload the video that is going into our servers, Patient Pharma servers, and it should show up here in a second. So what is actually happening? So this as the nurse each morning, each afternoon, or when I'm walking down the corridor to see my patients. So these are my 3 patients I have. I could have 20, I could have 30. We have just picked 3 for the moment, so I'm clicking on this one. And we can see there, the top one is the video that Colin has just loaded. That purple circle is the video encoding and encrypting. This is a completely secure lockdown platform. Videos can't get anywhere. So in a second, that video is going to have come through. Just while we're waiting for it to encrypt, I'm just going to scroll down. You can see these are all test videos. Obviously, it's a test account we set up. R is a response that I have sent back to Colin already, or whoever the patient might be. And there's also a B in here, which is actually a broadcast. So that's a message that the nurse has sent out to a group of patients. It could be encouragement to go for a walk, it could be an update on their medication, it could be something to do with the clinical trial they're on. So essentially, this is a very simple platform. It allows patients to send a very short message, maybe 1, maybe 2 minutes, maybe even 30 seconds in the case of Colin there. And there it is, just come through now. So I can play this on my app again as I'm walking down the corridor. Okay, in the interest of time, you heard what he said. So I've seen this, he's talking about the rash in his hand. We've seen this with 20 other patients as well, so I'm going to reply to him straight away. So I'm going to say, okay, here we go. Hi Colin, I'm very sorry to hear about your hand. That's actually quite normal at the stage you're at in the clinical trial. What I'd suggest is you put some moisturizer on it, and if it continues, do this again, but send us another video in 2 days, and hopefully it'll be gone. Thank you. So I just click use video, it starts to upload. It should jump back, it should upload it. I can put it in a title if I wish. Breakdown, unfortunately. What effectively, it's just coming up. I can see that I've sent a response here on the app, and it's coming up on Colin's app as well. So what I just want to show you very quickly, this part didn't work, we move on to the next part. So that video now has obviously helped Colin, who's at home 50 miles away, to deal with his situation rather than having to go to his GP or going to a doctor or the hospital, and to put his mind at ease as to how to deal with it. So that video is now on our platform, and what we can do with it as well is we can analyze it and tag it, the content that's in it. If I can get this going. So I'm just going to log in here as an analyst. Now, as I said, this is a secure platform, so I'm going to be asked for extra verification here. I'm going to be asked for a code, which hopefully will come through. Okay, so the code has just come through on my phone. It's what's known as two-factor authentication from a security point of view. So, okay, so this is the project that I've set up specifically for this. So I click on it, I can click on the Barcelona site, and up comes the patients that are on this clinical trial. So I can click on this patient, which is Colin. I can see a list of the videos that he has sent and the responses we have sent to him. I can click on his latest video here, and what we can do is we can play the video there. Sound is much unfortunately. I can put in a transcript here of what's actually been said and save it. Most importantly, I can go down here and I can extract the key pieces of information that's been said on the video. So, for example, the category, if you want to extract a nugget of information, the category, for example, he's talking about is a rash in his hand. So it's a side effect. So we classify as side effect. The specific topic is a rash on his hand. We can put a quote if we want to specifically for what he said, and we can rate it as, well, let's say it's mild. The impact of it is that he can't wash his hand, for example. Again, we can put in a quote. We can say how that's impacted his life on a scale of minus to plus, whatever it might be. And the outcome of that is that he can't go shopping because he's afraid to go out, or whatever it might be. And also, I can also note that he looks quite tired because he was up at 3 o'clock last night. And we can put in the actual time in the video that nugget of information was extracted from and save that. So there could be 1, 2, 3 nuggets, there might be no nuggets, but we can extract these nuggets across videos as they come in and start to paint a picture, because we can see that across 50 videos over the last month, a lot of them complained about a rash in their hand. So it's okay, I've stopped told. There's 2 parts. It's between the patient and the nurse. Thank you very much.
Thank you for the fastest 4 minutes of your life. Congratulations. Okay, I don't know if Chris or Tracy have some questions. I guess we can do that.
Is it an application that is very easy to get uploaded to the work phone or?
It's available on the App Store, so the patient can do the uploading.
Obviously, it's a completely secure platform, so obviously our clients would be the hospital or a pharmaceutical company. So we set up who has access, but we can also allow nurses to do that. They can give administrative access, so they can set up patients as they come in and provide them secure access. So it's literally 30 seconds to download the app. You set a patient up for 30 minutes, you provide them with access. Obviously, this is a very human system. We've had patients in their 80s using this in clinical trials. Once they're shown how to use it once, typically they're over the hurdle of, oh my god, I don't know how to use this thing other than making calls. And then they go home and they're quite comfortable using it. But as I say, it's a very simple process. And that is the key thing that a lot of people forget in developing apps. If there's any complexity, most people won't use them. But if you're allowing them to connect with their medical team, which is what we do, it's very powerful and useful thing for them, and they will continue using it.
Okay, thank you, Bartley. So we have the Imito team ready to do the presentation about their IT solution. Let me see if I find in my appointments. Oh, here, because you changed it. Oh, well, Crescent Sulzberger. Okay, so Crescent and Manuel, the founders of the Swiss startup Imito, will demonstrate how the mobile solution for simplified clinical photo documentation is used in the daily routine of a nurse. Okay, please go ahead, feel free.
Thank you, Thiago. So, good evening, everyone. Today, my co-founder, Manuel, is our patient. And 1 week ago, he had surgery on his elbow. And right after surgery, we did the first assessment of his wound. So, first of all, we did an overview shot of the wound right next to his elbow. And then we did a close-up shot as well, where you can see the measurement. So we measured the wound area, and it was almost 20 square centimeters. And we documented as well the flexibility of his elbow. So, yeah. And today, we're going to do another assessment of his wound one week later. And to do so, we first need to identify Manuel as a patient. So,
Chris is now scanning in the barcode of the wristband. This identifies me as a patient. Then Chris would like to take an overview shot of the wound. And then he would like to measure the area of the wound, size of the wound. So for this, he's going to place a QR code next to the wound.
right. Okay.
So the QR code is used to calibrate the image. It's like a reference. And Chris is now selecting the area which needs to be measured. He can adjust it as well if he wants to.
Okay. Yes, and now if I hit on measure, we'll see the area of his wound is now around 10 square centimeters, so which means it decreased since last week about 10 square centimeters. 10 centimeters, which is great. So if I'm going to finish now the wound assessment, the images are uploaded into Manuel's medical record in our hospital, and this is valuable for me if I'm going to do in a couple of days another wound assessment, and I'm then able to compare the images from the earlier assessments. And this is not only valuable for me, as I said, this is as well valuable for my colleagues, physicians and nurses, which are involved as well in the treatment of Manuel's care. So, and it does not stop here. As soon as Manuel leaves the hospital, in hopefully 1 or 2 weeks, he will be able to document the wound and the healing progress of his wound with an app we've developed especially for the patient. So the images will be sent into our platform and will be available as well in the medical record of Manuel. And we've developed something else, especially for you today.
So yeah, the wound measurement tool which you've just seen before is part of our main application, which is called an app which is called Imi2Measure. It's free, it's in the App Store, and you can download it today. Oh yeah, of course. And then, of course, you need for this there are stickers in which Chris just used before, and if you place this next to the wound, you can then measure it on your own. And it would be great if you can get some feedback from you on this feature.
So, thank you so much for your attention, and we'll keep that.
I will download one at once. I mean, I'm working in the area of wounds, lung cancer. Imagine my own patient.
Yes, I have a question, a very brief one.
Thank you.
So thank you for the opportunity to network a little more with the Imi2 team. Now I have a question, a very brief one, and I invite you to do a brief answer also. Can we have the measurements of other parameters, of the variables of the wounds, with not only the diameter and the size, but related to the evolution? Can have a broader evaluation Is that possible with your solution to
So
get the
to compare-
intelligence to solution and not only the dimension of the wound?
Yes, we are able to help to compare the wounds. So to show,
For example,
yeah, just the different the size, but on the other hand, we are working as well on the image analytics, so to show the different tissues in a colorization of the wound.
okay.
So does that
Yes,
answer the
because
question?
that's very important. The nurses know that we have to take into account very parameters of the wound and the dimensions and the evolution, the trends of the dimensions are, as many as well, an outcome. Okay, so it would be very useful, I think, that we could have an IT solution with a smart technology that tell me what tissues and characteristics of the tissues are present.
Yeah, we are working on that. It's not yet available in the app. We did already, but it needs a clinical trial to really have the facts needed for the image analysis.
That would be very interesting. Thank you very much. And probably more at the end of the session. So who's the next? Oh, hello. Thank you. We will now have a presentation from Simo. I don't know how to say your name, but I will try. Please. Which is an award-winning, congratulations, home care management and communication software for all stakeholders in the care loop. Today, we will see how it benefits the nurses and the carers in the field work. Please feel free to start.
Thank you. Hi everyone. Imagine yourself being a home care nurse. So you're visiting your clients in their own homes. Most of them are older people, but also people of many ages discharged from hospital after a surgery, for example. In your everyday work, you work very independently, alone, but luckily you have your Nurse Buddy app on your mobile. When you start your work, you will log in to the app. Here you will see your day overview. You will see all the client names, the visit times, addresses, and any other access information, icons for different services that you should give them, and you can also see images of the clients to help you memorize how the client was. Let's go to meet our first client, Paul. You can now see that Paul is using Vivago arm watch and an activity tracker. You check his details. Here you can see all the conditions, all the contact persons, any other important information, his medication, and also the client diary, where you can see all the updates from other nurses, care professionals, care coordinators, and even family members. Now you remember that last time Paul was very tired and you were a bit worried about him. You see that Paul has set an alarm using his watch, and there's definitely been an issue with his energy levels in the past couple of days. This is based on the observations by the nurses and also the activity tracker that Paul is using. Now you have some good news for Paul. There is a chance that the doctor can change his sleep medication to help him feel better. Now you continue with your visit actions. You measure the blood sugar levels. give Paul medication, and also take care of his foot sore. I hope we can partner with a good startup in measuring wounds. When you're ending your visit, you can also leave your open text notes by typing them in or using, sorry, I will cancel this, save time, or using the, it's a feature that our users love. All feeling a bit better now. So automatically measures the visit time for reporting. We at NurseBuddy believe in collaborative care and transparency, and we have built an easy-to-use software to make that possible. Thank you.
Thank you, Sil, for your rigorous use of time, which I know is not easy. It is kind of. Thank you very much. Chris or Teresa? This is a question for three. Looking at my notes, how do you think the healthcare providers are going to deal with this proliferation of apps? Most of what you're describing is very point-to-point. People who are within a trial or being seen by a particular nursing group. Certainly in the UK, we have nurses and other allied health professionals working across multiple agencies. And we've also got patients choosing apps that they want to use. I can't see that without some common platform, common API or common language that we're going to be able to expect our healthcare providers to log into 20, 30 different apps to care for their patients. Any thoughts on that?
Yeah, that's a very, very good question. So, I hope people can hear me.
You can, yes.
So that's one of the reasons why we have integrated many sensors and different information sources to our app, which is but I agree, our app is still focused on home care only. We have also integrated to electronic health records, so we can take all the information there. So that's pretty much what we can do. But I know it's some level of a challenge.
No, it's a very interesting question that we can discuss and use in the final panel discussion. Thank you once again for your presentation and for your solution also. And now we will have Marc Fortes presenting us their solution called Enfermera Virtual in Castellano, which in English would be virtual nurse. So please,
okay,
feel free to start.
Thank you, Tia. I'm going to talk about the Enfermera Virtual project, okay, but in this case, the mobile application. We have developed this application in the Association of Nurses of Barcelona, okay, together with University of Barcelona and about 70 health professionals, more or less. The purpose of this application, we can see here, is provide to the citizens, okay, to the people, trusted information or content, because people search in internet, okay, search in internet about diseases, about health, about symptoms, and everything. And this, not all of the people searching internet is good content, okay. And we propose do this kind of trusted content, okay, And now we have 2,600 pages of trusted content for the University of Barcelona. Okay? And on the other side are the health professionals. Okay, and in this case, Enfermería Virtual is a tool to the health professionals to share this trusted content to the people. And okay, so now I'm going to explain how it works. Okay. You can see here, Tira tu Salud is like health tutorials. Okay, and here you can see the diseases like cancer, diabetes. Okay, and you have here you have questions. Sorry. Here you have questions about these diseases, okay? And the most important, you have the trusted answers to this question, okay? Come on to the next. The second item is videos, okay? Here are videos about diseases or health, like health position at work, or how to control the pain with the breath, like this. Okay. The third item are the infographics. Here we put the content in visuals, okay, like this. For example, what to do when you have a hypoglycemic. Okay. In this case, it's a good content to put in the door of the fridge. Okay, and the patient how now what to do in this case, and the family. Okay, the family know what to do in this case. About 2 minutes. These icons, features, and human body are for the professionals. Okay, to share good or trusted content to the people, specific content. This is a QR scanner, easy to use. And finally, we have our social networks, okay? Instagram, Facebook, Twitter. It's better to you follow us because we have health programs, targeted health programs in the social networks. And finally, the information space. Here you have our telephone number, our email, okay, and it's download the application. It's for free in Android market and iOS. And no more. Thank you to everything.
Thank you, Mark. Thank you for your interesting solution. The question Chris did 4 minutes ago could be used to in the same way. So we think I think we need an intense and accurate debate about the useful and well, how can we use and prioritize the solutions that we have in order to reach the goals.
Where I work in Forward, trying quite hard to produce trusted apps, or at least verify every app around. They gave up very rapidly. They're being created faster than you can possibly assess them. So it's a great thing to have something local available to your patients.
Okay, so we are ready to the next presentation, which is the Gimbernet. We will have the Gimbernet now and then the last demo of the Salac, the Mira solution, or because we have another demo, the Mira solution, and I think it is better to listen to the presentation of Mira. And then, because you will not present us an IT solution, but you'll talk a little more about how can we prepare nursing professionals to use and to develop this technology. So the more logical sequence. Just that. No, but sorry. No, the fault was mine. I'm moderating the session. Okay, so we have with us Unai Maguregi, who is talking about a SAVAK solution called Mira, and he's the product manager of SAVAK Consultors. Okay, and SAVAK is the IT healthcare company of GFI, I think. It's going to show how Mira, which is the solution itself, can help nurses to make his work more efficient and without wasting time. Very important. Read. So, okay. Please go ahead.
Good evening, everyone. From SAVAK, we have been thinking how the new technologies can help nurses in his day-to-day real job, not in the theory. And this is what we set about doing 6 years ago when we started developing our clinical station Mira. As a nurse, when I work with Mira, the system allows me to have a general view of my patients and my work. I can see the bed, surgery agenda, emergency locations, normal things. But how can the system help me in a shift change time? Normally, the first problem that I have is too much disjointed information, which makes me waste searching data about one patient, waste time. How can this system help me in the most natural way? Reading. What do I usually read? Books. Mira have a component that writes the information of the patient in a book form in a such way that to know the patient state, the system doesn't force me to explore different modules, but allows me to know all necessary in a simple book. On my book, I can see all the information that I need only watching a book. Or I can see clinical progress notes, constants, activity requests, everything. The information of each day will be reflected in a different page. This book enables me to choose the information that I want to read, giving me a customized book. Each nurse can have a different book, selecting which information want to be shown in the book. After reading the book, if I need to complete the information in more detail, of course, I can go to the corresponding module. Of course, we have a lot of more modules like focus charting, constant graphic, fluid balance, nursing task administration, drug administration. But in the first time, I only need to go to the book, read, and then I have a global situation of the patient. In addition, thanks to the interoperability of the system using HL7, the information that the system shows is not only the one that I put in. Mira can show information from other systems without looking elsewhere. For example, here we are watching the constant, and the constant comes from the constant monitor. But I don't need to go to the constant monitor to see that information. I only need to read, and I have everything here. The same, for example, happens with the laboratory data. Another example of this ergonomic and human language approach is the plan of nursing care. I know that the implementation of nursing care plan can be very hard and as well as allowing considerable clinical variability. How can the new technologies help me in this? Creating a tool that allows to transfer natural language to the standard care of plan. We manage with a configurable questionnaire for nurses to register the necessary information so that the system identifies the diagnosis that the patient has. We need to answer to some questions, and the system is going
challenge to present solution. So the electronic health records solution. So
It's a complete solution. We only see 2 modules.
not only for nurses, but for all other health professionals.
Yes.
We have a profile for nurses, but it's a broad solution.
Yeah, it's a solution for other people who need to work with the patient. Even doctors, even social assistants, all in the same solution. We see only the part of, more part of.
Of course. Okay, I think we can talk a little more about your demonstration and your product at the final of the session. Thank you very much. And now we will have not a demonstration of solution itself, but a brief presentation. From Carlos Martinez. ¿Cómo estás, Carlos? He's from Enfermeria Gimbernat, which is a nursing school. So I think it's very, very interesting and useful to think about the human context before the technological one. Okay, the technology and the solutions itself are not very useful. We need people prepared to use them to reach the outcomes we want and the citizens need. Okay. So thank you. You can start whatever you want.
Much, and we are working in that. We want to change the mind with our university program. We don't have a technological solution, and we don't have a demo in Health 2.0. We have a university program. It's our students learn how to be an entrepreneurship or how to be an innovator. We want to put, or we want to plan this little sheet in our students that stimulate the attitudes or the competencies in entrepreneurship and innovation in Health 2.0. Let me show you the program. University School is of Nursing Gimbernat is in Barcelona, in 20 kilometers to Barcelona, in a little village in Sant Cugat del Vallès. And the university focused its learning model on innovation and entrepreneurship. We are working in 2012. We create and we design Open Thinking. Open Thinking is a university program and is an innovation nursing program aiming to study students for creative nursing. Open Thinking allows the students to develop an enterprising idea related to health, and of course Open Thinking wants to design innovative services and as well products at nursing at the same time to generate business. During the next year we want to initiate another line of working with our students to try to define services in health using always Health 2.0 technologies. The main objective of the program is to increase innovation and entrepreneurs' attitudes in the field of health in great studies. We want to develop and to design business idea or product health. We want to validate and to execute the business model. Our students is working on that. And another objective is contribute and increasing the value in nursing. The program has 5 phases. Phase 1 is the theoretical phase, theoretical lessons. Here, our students work the concepts and on creativity, on innovation, and enterprise. The second phase is where our students are define and design new ideas. They develop a lot of ideas of one product in innovation, and finally they choose one of the ideas. Let me show you. Phase 3 is the phase of the business model. They are training in lean startup and methodology. They have to build their own business model canvas about the innovative idea. Phase 4, sorry, because I'm trying to work with my computer and the presentation. Phase 4 is the ability. Here there are 3 steps. First step is the selection of the best projects in the university. 3 teachers on the university and the director, they select between 12 projects or 20 projects, they select 50% of the project to pass to the last phase. The next steps is meetings and mentoring with partners of the programs. Partners are working with us, but they are not in the university. They are companies, public and private companies that are very close and very involved in entrepreneurs area and innovation areas. And last phase is the mentoring, the best in ideas and best projects. Work with our partners, and it is conducted by our partners, and the students can develop the projects with mentoring. They are our partners, companies, private companies and public companies, and as well we have startups, crowdfunding as Capital Cell. Startup on Red is an enterprise that they are working with entrepreneurs. The Sade Crapoli is people from Spain know Sade Crapoli. It's a university that works very close with business. Fundació Sant Cugat Actiu is working in the government, in the ayuntamiento, government in the village, yes. And Youth is a national program with entrepreneurs as well. And we are working our partners as Health 2.0 of Barcelona. One of the examples, this is one of the projects of our students. The name is PillMac. PillMac is like a coffee machine. You put the pills of the patients of your family, and caregivers or the patients or the nurse can program the coffee machines, and they will have yes. Sorry. This is one of the examples. Is PillMac, and PillMac is a drug organizer. This is a prototype, and it's like a coffee machine. Patients and caregivers can prepare the prescription for the day, for the week, and PillMac serves the dose at the time when the patient wants. If the patient forgets the dose, send a mission to the caregiver or the family. This is one of the ideas of the project that you can find in our program, our university program. Well, I want to put some testimonials about professors and students. It's very fast. Can you have, yeah? Video is in English, it's in Spanish, but you can find it, the subtitles in English.
Potenciador de la cultura innovadora. Se configura como centro dinamizador del espíritu creador, emprendedor y potenciador de la cultura innovadora.
Nosotras empezamos a trabajar en el mundo de la emprendeduría. Pensamos que la formación en esta línea les podría dar otras salidas profesionales y a la vez una visión diferente de la vida.
El proyecto Open Thinking se ha creado para que los enfermeros puedan llevar a cabo su proyecto emprendedor. Somos conscientes de que al empezar la formación no nos encontrábamos en un foro de emprendedores, sino con personas con una iniciativa y que hemos acabado de despertar la luz que llevaban en su interior.
El programa Open Thinking
May we put the other testimonial? They are professors in the university, and this is one of the studies of the students.
Nosotros fuimos seleccionadas por la empresa Worldwide Vita, que es una empresa que se sitúa aquí en Sant Cugat. Gracias a ella hemos podido desarrollar nuestra idea y crear un proyecto que cada vez más se acerca a lo que sería nuestra propia empresa. Ellos nos han proporcionado las herramientas para que de alguna manera una idea que no deja de ser algo que ha salido de la universidad se acabe convirtiendo en tu proyecto, en tu propio proyecto y en tu propia empresa.
Preparamos a nuestros estudiantes para asumir el reto que supone este nuevo rol del liderazgo enfermero en la transformación de la sociedad. El reto de futuro es ver cómo los profesionales transforman el sistema.
Well, this is our program, and thank you very much for your attention.
Thank you very much, Carlos. Well, it's now open the question and answers panel with all the participants and the auditorium themselves. But if you don't mind, let me start with two general ideas, okay, and also to give time to you to construct your questions. But I think it's very important to have two main questions in our head when we talk about technical solutions or IT solutions in the daily mission of nurses or of professionals. And which is, in one hand, for what we need the technology and what technology we need for that purpose. And this is a rationale that we have to develop and to state very clear before all the work of develop the technology itself. I think this is very important, and I think this is crossed with the idea of Chris and with his question. So we have anyone interested in? Okay.
Chris made is a very good one. There are a lot of applications all the time. It's likely those applications I know some patients, of course, are not
Is it on? Yeah. So, some patients have multiple medical conditions, but quite often a patient, until they get to that stage of their life, they maybe have one medical condition. So it's quite likely that one or two applications might be very useful for that. I think it is unfortunate for the healthcare professionals. They're going to have to learn to use a lot of apps, but patients themselves may only have to learn to use a smaller number, which might be specific to their medical condition or the episode of treatment they're having. But of course the day will come, it's probably already there, when like patients are coming to the doctor with their own diagnosis and suggested treatment, they're probably going to come to the doctor or the healthcare professional with their suggestion for the app that they want as well. So it is a very real issue. It's very difficult to keep up with the development of apps to try and, create a preferred list because they're coming so fast. But it is, I think patients will probably use a few, but the healthcare professionals will have to be familiar with a lot. Do you think there's any room for getting together and doing an Obamacare single language or HL7 approach or something that requires some sort of CE marking of apps to allow interoperability? Because I appreciate what's being said around, your app will integrate with a number of systems, but we're well aware that integrating with multiple systems is A, slightly unreliable, and B, extremely expensive. And I'm not sure, I could be wrong, maybe I'm just getting old, but I'm not sure that we're going to be able to persuade healthcare professionals to work with multiple applications. It's certainly in the UK, it's hard enough to get primary care to use more than their system. So I don't know. I mean, I think the genie's out of the bottle, and we can't put it back. But maybe we need to. I'd be interested in your views as to how we allow the healthcare professionals to get the most, and the patients, most importantly, to get the most out of all of these apps.
And in Sweden, I think we are quite protected by our hospital. It's either a blockage or it's open way. I mean, every application they have to go through a lot of security before it can come to us. And when it comes to us, it's all unrecognized and old-fashioned. Toss it away. And for nurses, I have seen a few of these applications. I was just wondering, do you have nurses as your test person? Because my experience, 25 years, that's too much information on one screen. And to click on many things, I don't have the time. I'm taking care of my patient. I just want to have one screen and then I get my answer. So that is one of the weaknesses I see that I identified by.
Can I just follow up on that? I was actually going to say the same thing. And it is obviously a huge issue that there are so many different types of technologies out there, be it apps or whatever they might be, trying to address specific problems. And if you have a patient with multiple issues or multiple conditions or multiple treatments, you know, they may have to use all of them, and their healthcare team may have to use all of them. Because just because they might want to use them all individually, that doesn't mean you combine them all into one app, because then you end up with a problem of, you know, an 80-year-old trying to use it, or a 40-year-old maybe trying to use it. Where do I go? What do I do? So I don't think combining them is the right approach. You always have to start with simplicity for the end users. So it's I suppose maybe streamlining it in some way in terms of use and guidance.
I completely agree. Combining them is not an option. I suppose it's where the common language is, but it's easier said than done.
More comments? Or feel free.
Yeah, okay. I come from Finland. We currently have a big movement from mainly from the most modern IT companies in Finland. It's an open source. It's not really an electronic health record. It's kind of a data storage and the very core of the electronic health record that stores and transfers the data in a standard format. So any app or even the Jurassic healthcare software can connect to the core, and then any user interface or any app can take data from the core or put data in the core. But of course, it's not we are actually a part of that movement as well. But it's not in our hands if that system gets approved and bought by somebody. So fingers crossed.
More questions? Thank you.
I have a couple of questions. One is, do you have the feeling on how?
I think it's better because I'm not.
It's fine.
If they can hear you, thank you.
I was asking if you, in general, got the feeling about how nurses could perceive these kind of applications to, let's say, to use telemedicine and remotely control patients, because from one side, it could be exciting, I'm sure, to be more efficient and to can work remotely, but on the other side, if there is no regulation on their daily work, as you mentioned, I mean, some part of them can be afraid of, you know, being having a bunch of patients or bunch of data and loads of videos to have to watch remotely, and they already have a lot of pressure in their practice. So, which are the feeling? I'm sure you have the perception. And the second question is about the skills of older adults. As you said, the majority of patients are older adults or the population. So. Is your market director or your target director to the future older adults, which are now technologically comfortable people, or do you have data about, sometimes it's probably a myth more than a reality that older adults cannot use smartphones and interact. Do you have a direct perception?
Yeah, two very good questions. On the people using it and age, I think very much depends on the person. Some people even, you know, at 50 don't want to use these things. Other people at 80, depending on how technologically savvy they are or interested in it, and if they feel it's a good benefit to them, they will use it. But as I said, it comes back to, for us, the simplicity of use and how much benefit they get from it. I mean, what we're doing is we're providing them, particularly in clinical trials, people with access to the most important people in their lives when they're on a clinical trial, and that is their medical team. So even if they have never before used a mobile phone or a tablet for anything other than making a call, sometimes they are willing to do this because of the value to them. And to your first question specifically, of course, workflow is a huge issue in what we do as well. Most nurses and doctors, when they see our platform, the first thing they think is, oh my God, I'm going to have 500 videos to watch every day. Which of course is not going to work for anyone. Expectation management is a huge thing. We don't just drop our platform with the medical team and say, there you go, roll it out to all your patients. Because of the experience we've gained on projects,
from the UCT. This is I don't see a positive beyond that. No. I mean, I appreciate that you encourage them, but I would rather those people that spend the money and become nurses actually go to the hospital to work, to gain some experience and help us out, because we are a dying profession. So.
Well, it's a vision. It's a possible vision, and I think it's a critical position, very interesting. But I don't know if you want to do some replic work.
I actually think it's responsible for that. Of course, it's going to be a balance, isn't it? Of course it is. And I appreciate the arguments on both sides, and certainly there's been some kickback in the UK about the way, I'm no expert on this, but the way nursing training is being delivered. But personally, I think encouraging entrepreneurship in nursing is absolutely. So sorry for my presenter, but I think there probably are things that can be lost from any course.
I mean,
it's okay now. We have two programs. We have one program with innovation and
after years in the they don't want to do nursing anymore. So I'm asking, what's going on? I don't want them to start stealing from the UCT already.
Please.
I have a question for Mito.
We need a microphone so we can hear you. The question is for Emito, I think.
Hi. I have a question for Mito. Do you have? Are you thinking about implementing a balance rule color to auto-correct the photograph between the different episodes?
Very relevant question.
Yes.
Wait for your microphone, please. You can go there, please. Crescent, you can go there and answer.
So the question was if we provide possibility to calibrate the image, so to have the colors white balanced. Yes. Yeah. So since